Hi there, it's David Cuviello, registered physiotherapist from Zero Gravity Physiotherapy. Today we're going to be talking about rotator cuff injuries. We've all heard of the rotator cuff, and if you're watching this video, you have probably either recently been diagnosed with a rotator cuff injury by your doctor or your physiotherapist, or you just want some more general knowledge of the area and some of the injuries that persist in this area. The rotator cuff is actually an umbrella term. It's a group of muscles, okay? It's a group of 4 muscles that actually wrap around the shoulder joint, and they wrap around from the shoulder blade itself to the actual arm bone, the humerus bone, and they allow us to rotate the arm, lift the arm, and it actually also adds stability to the arm. So every time we reach for an object or throw a ball, our arm does not dislocate, okay? So if we take a look at a schematic model of the shoulder joint, we have 3 basic bones that come together to form what we call the shoulder joint complex. There's the collarbone in the front, there's the humerus bone, so that's the actual arm bone on the side, and then in the back we actually have the shoulder blade, or the scapula itself. If we take a look, we'll see, if we were to orient it, it would look something like that, okay? We have one big large muscle in the front of the scapula called the subscapularis. That's the first rotator cuff muscle. We have 2 in the back. One's called your infraspinatus and your teres minor. And then the one that's most commonly injured sits right on top, and that's called your supraspinatus. The reason that's the most commonly injured, if you take a look, the one on the top runs, and it has a ring of bone and ligament that sit over top of it. And what can happen is, over time, with repetitive use, you can get some thickening of this tendon, and it can actually dig into the bone that sits above it. That can cause, over time, little nicks and little tears, and something we call an impingement syndrome. So you may be feeling symptoms where every time you're raising up, you're getting a catching sensation, or a clicking, or a clunking. Over time, that can get more prevalent and more painful, where you're getting pain all the time. You have this chronic inflammation in there. Treatment for an injury such as this, we're looking at rotator cuff injuries, so rotator cuff tears, impingement, inflammation syndromes. We're looking at treating the symptoms initially, so that's decreasing the inflammation. That can be achieved by rest, icing, anti-inflammatories, Voltaren cream, and that's really best discussed with your physiotherapist or your physician. When you have a greater injury where the actual rotator cuff has snapped and torn, we call that a full rotator cuff tear. That, unfortunately, cannot heal spontaneously. The area has a notoriously poor blood supply, and what that means is when you have an injury there, it doesn't do well with respect to healing on its own. We need outside intervention. And if you think of an elastic band that's been cut, the ends rip apart, they're under tension, and now we need to pull them back together and repair that, and that's best done surgically with orthopedic surgery. Once that's achieved, typically someone's going to wear a brace or a splint for 6 weeks, sometimes longer, sometimes shorter, depending on the injury and the surgeon, and then a period of rehabilitation will occur afterwards. And that can take anywhere from 3 to 6 months truly to get full flexibility back, full strength back. But generally patients do very, very well, and they do recover fully, and they are pain-free afterwards.